Hi, I'm Dr. Pirko. Welcome to Ideal Plastic Surgery. Let's talk about Brazilian butt lifts. Brazilian butt lifts, also known as all-around liposuction with fat grafting to the buttocks and hips, are really one of our most popular procedures. We do perform 3 or 4 of them most weeks, sometimes we do 3 in a day, but we get many more requests. The issue though is that while they are a fantastic procedure for the right patient, they are not for everyone, and it is very important to understand how they work so we can understand if you are a great candidate for a Brazilian butt lift or not. The results of a Brazilian butt lift depend on 3 things. The first is how much fullness do you already have in your buttock and hip areas. The second is how much fat do you have available for grafting, that we can do liposuction in unwanted areas and add it where you want a little bit more. And the third is, are you going to be really compliant with the instructions? This is important because Brazilian butt lifts are the only procedure that we do where the patient can also affect the result of the outcome. It's not just the surgeon, this is the one procedure where it's very important that you follow the instructions correctly so you can have an ideal outcome. A Brazilian butt lift is started with the correct markings. You and I are going to mark the areas of liposuction together as well as the areas for fat grafting. The liposuction is typically done on the abdomen. We do 2 very small incisions in the front, and through those we can remove all of the unwanted fat on the front of the abdomen and the flanks. After that, we're going to turn the patient over and we're going to have to do liposuction of the back with just 1 incision in the back, right in the center, and you and I will mark in front of the mirror the areas for liposuction, typically the love handles and the bra roll. We are also going to mark the areas where we're going to add the fat for grafting. The most popular areas are the hip dips and the upper portion of the buttocks, where most patients want more of the fat. But everybody has slightly different goals, and we want to make sure that you tell us exactly what you want so we can achieve your ideal goals. The areas that don't work so well are the junction where the buttock and the thigh get together, because if we add fat on the lower portion of the buttock, it can sometimes lead to a heavy, saggy buttock. So we don't like to add it in those areas. And we can go over those together the morning of surgery. After that, we will bring you here to the operating room, and our anesthesia team will have you go to sleep completely. And under general anesthesia, we're going to then perform the liposuction using high-frequency vibration-assisted liposuction and a completely closed system for processing of the fat. None of that nonsense of using a spoon or little syringes for the fat grafting. We have a completely sterile system for your safety, and we're going to then transfer the fat back in using the same high-frequency vibration system for micro fat grafting pockets to optimize the amount of take of your graft and give you the ideal result. Once the surgery is completed, we will take you back to recovery. You will wake up in recovery wearing the garments already, and we will allow you to recover completely there before sending you home that same day. After your Brazilian butt lift, you get to go home or to the hotel if you live far that same evening. We want you to come back the very next morning for a quick checkup, and that is the last time we want you driving around. After that, we expect you to go home and stay at home for 3 full weeks and avoid putting any pressure on the grafted areas during that time. It is important for you to understand that the fat cells that we have just removed with liposuction and placed in new areas in the beginning do not have any blood supply. If they are going to survive, if they're going to live there for the rest of your life, we need to give them at least 3 weeks to engraft, to form new blood vessels so they can get nutrition and oxygen. That's why we want you to buy a special pillow where you can put pressure only on the back of your thighs when you're sitting and not put any pressure on your buttocks. That's why we want you to sleep only face down for the first month. That's also the reason why we would never, and none of our friends who are board certified plastic surgeons would ever, combine a Brazilian butt lift with any kind of surgery that would prevent you from sleeping face down, such as breast surgery or maybe a tummy tuck. We can only do one thing at a time, so you can safely avoid putting pressure on your buttocks for the first 3 weeks and really give each fat cell a chance to engraft and live there forever and get an ideal result from your Brazilian butt lift. The results are going to therefore vary with three things, like I said in the beginning: the amount of fullness that you start with, the amount of fat that we can transfer on top of the fullness that you started with, and how compliant you're going to be with the instructions after surgery. This is the only surgery of all the surgeries that we do at Ideal Plastic Surgery where the compliance of the patient is super important, because we want you to have a great result like the results that you are seeing on your screen. Brazilian butt lifts are wonderful surgeries. You already know that they can help you achieve that sexy, curvy, feminine look that you want, but you may also have heard of some complications, sometimes disastrous complications. At Ideal Plastic Surgery, our #1 priority is your safety. That's why we have our own Quad ASF certified surgery center. That's why we have assembled a team of experienced nurses, anesthesia providers, and board certified plastic surgeons. That's why we have the state-of-the-art equipment that allows us to do all the liposuction and processing and grafting in a closed circuit that never exposes your fat to any risk of contamination or infection. That's why we always follow the American Society of Plastic Surgeons guidelines and avoid grafting deep inside the muscle or doing excessive volumes. With all that, we know that we can get you the ideal result that you want and get your Brazilian butt lift that will get you safely to the goals that you expect. At Ideal Plastic Surgery, we do perform more Brazilian butt lifts than anyone in our area. And I'd like to think that we perform more because we do them better than anyone in our area. Having said that, as we just explained on this video, it is very important to select the patients appropriately and to have our patients understand fully how the procedure works so you can get an ideal outcome. Thank you.